Introduction to Physiology Feedback Mechanisms. Homeostasis and feedback mechanisms. Homeostasis is the body's ability to maintain a stable internal environment despite external changes. Feedback mechanisms, primarily negative feedback, are critical in maintaining homeostasis. They act by detecting deviations from a set point, initiating responses that counteract these deviations to restore balance. The hypothalamus plays a central role, coordinating many of these feedback loops. Negative feedback, a stabilizing force. Negative feedback is the most common mechanism in physiology. It operates to reverse changes in a system, returning the body to its set point. An example is the regulation of blood glucose levels by insulin, where an increase in blood sugar triggers insulin release, which then lowers glucose levels. This feedback loop ensures the maintenance of normal glucose levels around 70 to 100 mg/dl. Positive feedback, amplifying responses. Positive feedback mechanisms amplify responses, driving processes to completion rather than returning them to a set point. This type of feedback is less common but vital in processes like labor contractions during childbirth. The hormone oxytocin triggers uterine contractions, which then increase oxytocin release, intensifying contractions until delivery occurs. Thermoregulation and feedback control. The body's thermoregulatory system is an example of negative feedback. Sensors in the skin and hypothalamus detect temperature changes, initiating mechanisms such as vasodilation or shivering to either dissipate or generate heat. This maintains the core body temperature at approximately 37 degrees Celsius (98.6 degrees Fahrenheit), with deviations quickly corrected through feedback loops. Blood pressure regulation, the baroreceptor reflex. Blood pressure regulation is tightly controlled by a negative feedback system involving baroreceptors. These stretch receptors, located in the carotid sinuses and aortic arch, detect changes in arterial pressure. An increase in pressure triggers signals to the medulla oblongata, which reduces heart rate and causes vasodilation to lower blood pressure back to normal, typically around 120/80 mmHg. Hormonal feedback loops, the HPA axis. The hypothalamic pituitary adrenal (HPA) axis is a critical hormonal feedback loop. Corticotropin-releasing hormone (CRH) from the hypothalamus stimulates adrenocorticotropic hormone (ACTH) release from the pituitary, which in turn stimulates cortisol secretion from the adrenal cortex. Elevated cortisol levels inhibit CRH and ACTH release, forming a negative feedback loop that regulates stress responses and metabolism. Calcium homeostasis, parathyroid hormone and calcitonin. The regulation of calcium levels in the blood is an example of dual feedback mechanisms involving both parathyroid hormone, PTH, and calcitonin. When blood calcium drops below 9 mg per deciliter, PTH is released to increase calcium levels by promoting bone resorption and calcium reabsorption in the kidneys. Conversely, calcitonin from the thyroid gland lowers calcium levels when they rise above 11 mg per deciliter by inhibiting bone resorption. Respiratory feedback mechanisms and pH control. Respiratory control of blood pH is an essential negative feedback mechanism. Central and peripheral chemoreceptors detect changes in arterial CO2 levels and pH, modulating ventilation to maintain pH within the normal range of 7.35 to 7.45. Increased CO2 levels, hypercapnia, stimulate hyperventilation, lowering CO2 and correcting pH imbalances, thereby preventing conditions like respiratory acidosis. Clinical relevance, Addison's disease and feedback dysfunction. Addison's disease is characterized by insufficient cortisol production due to adrenal insufficiency. This results from either primary adrenal failure or secondary to pituitary dysfunction, low ACTH. The lack of cortisol disrupts the HPA axis, impairing the normal negative feedback mechanism. Patients experience symptoms such as hypotension, hyperkalemia, and hyponatremia due to cortisol's inability to regulate blood pressure and electrolyte balance. Drug modulation of feedback mechanisms, corticosteroids. Corticosteroids are a class of drugs designed to modulate the body's feedback mechanisms, particularly the HPA axis. These synthetic analogues of cortisol can suppress inflammation and immune responses. In Addison's disease, glucocorticoids, e.g., hydrocortisone, are administered to replace deficient cortisol and restore normal feedback function. By mimicking cortisol's effects, they re-establish balance in the HPA axis and alleviate symptoms. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.